Good morning. I'm Jessica Lovell, and welcome to the Morning Medical Update. LaCheryl Rainey calls her husband her Energizer Bunny. Ray Rainey was always busy. He was always active until he wasn't. They didn't know at the time, but leukemia was zapping his energy. But today, Ray is doing well, thanks in large part to his teenage son, Micah. Today, we are learning how this family came together to help save Ray's life. But first, let's get to our morning rounds on this Monday morning. And is it really time to talk baseball already? Players for the Kansas City Royals are at spring training in Surprise, Arizona. And before they can take to the field, they got to have a physical with this guy. They cannot escape him. It happens the same time every year. Dr. Vincent Key is with us. He is the head team physician for the Kansas City Royals, as well as an orthopedic surgeon with the University of Kansas Health System. I know, you're up, you're early, and it's hopping there at training camp. What's going on?
Yeah, it's already jumping off here. I'm sitting here watching Salvador Perez dance in the weight room. But, yeah, we're getting things rolling. Started physicals, done with physicals, getting things rolling, and having a good time, getting ready to go for the season.
Yeah, it's really exciting. And so let's talk about these physicals. When you're doing these first physicals of the year, what are you specifically looking for coming off the off season? Are there any red flags you're looking for?
Well, it just depends. It depends on whether or not the player had been injured during the season, if they have been injured, what the injury was. Our trainers really connect with them during the offseason, seeing how they're doing, seeing how their training regimens are, whether they're injured or not. So going into spring training, then we're getting baselines on all the guys. So just in case there is an injury, at least we have a baseline. Whether that be orthopedics, whether that be internal medicine, any oral screenings, dermatology, ophthalmology, cardiology. So anything in terms of that, we just want to get a baseline on these guys.
So the biggest Royals news this offseason, besides that small detail of where the stadium is going to be located, that massive contract to keep Bobby Witt Jr. in Royal Blue. Tell us more about that, and what's it like working with him?
Oh, Bobby's great. He's been around this game a long, long time. I compare him to Patrick Mahomes because same way with Pat. His dad was in the big leagues in terms of baseball, and so was Bobby Witt Jr. His dad played in the big leagues for about 12 years, I believe. So he's great. He's a grinder. He's like Salvi, first one in, last one to leave. So, yes, the contract is an investment in him, and it's in being him and Salvi being the face of the franchise. There's only he has a really, really high ceiling. So we're doing some things, especially things down here. I know he wants to be what we call a 40-40 guy, 40 home runs, 40 stolen bases. We're working on some track work with him as well as a couple of the other players.
I don't know all the baseball lingo, but that sounds like a big, great goal to meet this season. So before we let you go, we have to ask, because this is, we call this your big day job, because when you're not with the Royals, you're back here treating patients in your clinic. So before we let you go, what advice do you have for young athletes about ready to take the field in any and all sports, boys, girls, advice for them, their parents?
I think it's all the same. I think in terms of baseball, softball, it's really prehabbing. And I think that's the big picture is prehabbing. I usually tell my pitchers, actually, they should have been prehabbing probably January 1st. My position players, usually the second week in January to get ready for their tryouts, which are usually the first week of March. So it's really preparing your body to get ready to do the event. It's just not rolling out of bed and just doing that. And I think if you prehab, you'll really decrease your risk of injury, whether it be shoulder, whether it be elbow, hamstrings, quads, whatever. So we here say we prehab so we don't have to rehab. So
that makes sense.
That's a big thing.
Yeah. All right, Dr. Key, we know you got a full day ahead, so get back to work, and we'll see you back here in KC soon, okay?
All right, Jess, I appreciate it. Thanks.
Thanks for getting up early. Appreciate it. All right. Well, when Ray Rainey learned that he had cancer, he also learned that it could be cured. That is thanks to the incredible work of doctors here at the University of Kansas Cancer Center, as well as Ray's youngest son. With me today is Ray Rainey alongside his wife, LaCheryl, and his 15-year-old son, Micah. Also, we have with us next to me is Ray's Dr. Mohammed Mushtaq, a hematologist and medical oncologist with the University of Kansas Cancer Center. Ray, I want to talk to you first because it's been 143 days since you got your bone marrow transplant, and we know Micah was your donor. I have to ask, how are you feeling today?
Today I'm feeling good. You know, sometimes, you know, it gets me a little bit, but most of the time I get up and I'm feeling good. Plus, my wife always say, Ray, get up.
She's like, get going. She's been, you don't have a choice.
Time to get up. Yeah.
Time to get up and get going and get doing life. LaCheryl, I'm excited to talk to you today because I understand, well, first of all, it's your birthday. And you said when we talked earlier that this is just a great way to celebrate your birthday, getting your guys here and just talking about this really fantastic story. So take us back to a story that we were talking about what are the first signs that you knew that something was going on with Ray about a year ago?
Okay. So, like you said, today's my birthday. So it was actually about a year ago to the day. I was having a birthday party at my house with a few of my girlfriends, and one of them came to me and said, "Is Ray okay?" And I was just like, wow, because Ray had been saying he was tired, you know, but he was working a lot. He was working 7 days a week on his day job, and he had picked up a part-time job to help out our older son with school and things like that. And he was also doing some other side work, helping people build decks, doing floors. And so when he said he was tired, I just thought, of course you're tired.
Yeah, who wouldn't be?
You're doing a lot. You're doing too much, by the way. Well, and so when he said he was tired, we didn't think much of it.
You chalk it up to just living life. Mm-hmm. So, and I thought it was interesting because you're right, you live with Ray, but then it takes somebody from outside the home, a friend, to come in and go, wait, something's off, because I understand Ray was usually the life of the party, and he wasn't quite living up to that reputation that day. So, Ray, did you notice that you were more fatigued than usual? Did this type of fatigue feel different to you?
Yeah, it did. It did, because I was, you know, besides all the work I was doing, I just felt I was coming down with a cold or something, because I was really tired.
And you had no idea that this might be cancer until you decided to donate blood. So thank you for being a blood donor. We know supplies are usually low. What happened when you tried to donate blood?
Well, I guess I went over, well, I kind of ignored my wife because she didn't want me to do it because I haven't did it in a long time. So, but I ignored her. And I just happened to go over there, and they told, after they ran tests and then they ran my blood work, they had said, well, we're not going to be able to donate today, but you need to make your doctor's appointment immediately because your blood levels are real low.
What went through your mind when you heard that? And what did you? I wouldn't have even known what that meant.
I didn't. Yeah. I mean, I was like, okay, what does that mean? She just said, well, you need to go to your doctor and have him set you up an appointment to get your blood drawn, and they can run tests on you. Well, I said, okay. So went to my car, called him. He told me to head over to LabCorp and.
Like right away, go right away.
Yeah, he said the order be in, just go over there and get your blood drawn.
So you end up at another hospital originally where you were diagnosed, you were admitted?
Yes. After they ran, oh my goodness. It was a lot of tests.
And then they sent us to that other hospital, and we went through hematology there, and they ran a lot of tests, had a lot of questions.
Yeah, I bet.
And then he was admitted.
So how did you end up at the University of Kansas Cancer Center with this gentleman right here to my right?
Well, honestly speaking, I can remember some of it, but I was just too focused on if I was going to make it or not. Because a lot of my friends from school end up passing from cancer. So I was listening, but I wasn't listening.
Yeah, that makes sense.
She was listening.
She was listening.
My wife was
So
listening, but
basically, the doctor was like, you know, he told us, we think this is what it is. We can definitely treat you, but KU is where you want to be.
And what did they tell you it was?
They said they thought it was leukemia.
Leukemia.
Mm-hmm. They weren't sure at the time, but they were pretty sure that it was some type of blood cancer.
How scared were you?
I was terrified. I was completely shocked. Like, it came from nowhere.
Came from nowhere.
And it was like in a matter of days, we went from partying to Ray has cancer.
Wow.
yeah.
So, Dr. Mushtaq, you know, talk to us a little bit about when somebody is sent over to you from another hospital. What are you looking at? How are you assessing a patient like Ray?
So we are privileged to have an excellent blood cancer and a bone marrow transplant program at University of Kansas. Excellent team of doctors, nurses, pharmacists, researchers. So in this situation, when somebody is suspected to have leukemia, we are the only leukemia center in the region, a member of National Comprehensive Cancer Network. So we try that patients are transferred to our program, and then they are started on treatment right away.
So is there something specific about Ray's diagnosis that made you very specialized in treating him? That's what I think I'm hearing you say.
So he had B acute lymphoblastic leukemia, so that's a type of an acute leukemia, and that can only be treated at tertiary care regional centers, especially the centers that have a bone marrow transplant and a cell therapy program.
So is it fair to say that this attempt for Ray to go donate blood on a random day is kind of what, you know, helped save his life and get him to you?
Yes, exactly. So in blood cancers, early diagnosis usually does not change outcomes, but if it is delayed, you can get into complications, organ dysfunction. So that was the right thing. Blood, everybody should donate blood, yes. At least a yearly basis. So he wanted to help somebody, and then he, in that process, found out that
helped himself. So either donate or attempt to donate blood. So let's talk about Ray's treatment plan. Was the bone marrow transplant, was that the #1 option? Was that plan A, or could there have been another treatment route?
So it depends. So in acute lymphoblastic leukemia, acute leukemia patients, not everybody needs a bone marrow transplant. Patients who have high risk disease need a bone marrow transplant. That's the only curative therapy. He had high risk disease, so that was the plan A from get-go. And he had high risk disease because with one cycle of chemotherapy, his cancer did not go into remission. So in those situations, our chemotherapy and immunotherapy medications, they are not enough to cure it.
You don't even bother going those routes. You go straight to the transplant.
No, they receive chemotherapy and immunotherapy drugs, and they get them remission. That usually means that we have cleared the field, but the seeds still remain.
Got it. And that's what happened with Ray?
Yes.
Okay.
And then a bone marrow transplant from a healthy young donor gives a new immune system, and that new immune system kills the cancer.
And we're going to talk about that very young donor here in just a moment. Ray's 143 days out. That's a crucial time period. What's next as far as getting checked up on, and what's that going to look like for him?
So the first year after transplant, unexpected things can happen, and he is now 143 days. 100 days we follow very closely, and now up to 6 months, 180 days, he'll see us on a weekly basis, and he's doing good at this point. There were some complications early on. They have resolved, and things are looking good.
So, LaCheryl, this became quite the family affair in more ways than one. Yes. You've got your baby sitting right next to you. Also, you have an older son, Brandon. He was in college at the time of all of this and this diagnosis. How did you walk your family through the decision to ultimately have Micah be your husband's donor?
Well, it wasn't easy.
Yes, I know.
We were hoping that someone else would be a match. And so, of course, people in the family volunteered to be tested.
Brothers, is that correct?
Brothers, sisters, and unfortunately, no one was a match. We were supposed to have Micah tested, but I was like, somebody's going to be a match. So we don't need to get Micah
And truth be told, I mean, donation is, by all accounts, is a safe process. But if you're a mom and this has just hit your family, you don't really know much about it.
Right.
And you're thinking, I don't want my baby to donate to anything or anyone, even though it's your husband. And so there's kind of this balance of trying to figure out, I want to save my husband, but this is my baby.
Right.
So
that's exactly where.
Yeah. So tell us about that a little bit, because that was a tough decision for you. You were hoping, you're like, nope, this person's going to make it. This person's going to make it. I don't even want him tested.
I just knew his younger brother was going to make it, and so I didn't even bother having, him do the test. So I started getting calls when the results started coming back one by one. Have you done the thing for Micah?
Nope.
No, not yet.
Nope.
So we need you to start thinking about that. Okay. So finally, I got the call. There's no match. We need you to
have him tested. Because you don't even know if that was going to be a match. So what was that conversation like with Micah?
So that I think that conversation was kind of okay, because still we were like, well, we don't have to use you. We can use a non-family donor.
You just wanted to get him tested.
In my mind, yes. So we talked about it, and it was still okay. Well, we'll get him tested, and he came back, and he was a match. And so from the medical side, it was kind of like, yes, we've got this match. Let's go.
And from a mom's side,
I'm like, wait a minute, wait a minute. I didn't understand the procedure and the process. That is why I was scared. I thought it was a more invasive procedure. Micah's a straight A student. He's the lead snare marching band. He was starting in football, JV, playing varsity football, jazz band. I didn't want to, disrupt his life. I didn't know, in my mind, he's going to be in the hospital for several months, and we've got other options for Ray. That was what my thinking was at the time.
Yeah, that's where your head was.
Yes.
Micah, where was your head when this was all presented to you? What were you thinking?
I was a bit nervous, I'm gonna be honest, but I knew if it was gonna help my dad live, it would have to be me.
What questions did you have? Do you remember just when Mom talked to you about it, you get tested, you find out you can come in and kind of save the day for Dad? That's a big responsibility, but you must have had questions.
I was just more worried about being under anesthesia, because I had never done it before. And I was really excited to have it just done, just have him cured, to be honest. And I was worried about how long I would be out from all of my activities like football, band, and stuff like that.
Yeah, you just wanted this behind you. You wanted Dad healthy and get back to living your life, right, in high school. So transplants like these have two possible methods: stem cell collection, which is kind of like giving blood, and then there's bone marrow transplants, which we're going to show you in this video right here. The donor needs to go under anesthesia, as Micah said, then have bone marrow collected from their lower back. And Micah went through this kind of what's called a bone marrow harvest. So Dr. Bushtag, why did Micah do the harvest instead of the stem cell collection? Why was that the route?
So there are several nuances in how we choose bone marrow versus the peripheral blood stem cells, but simply bone marrow is rich in stem cells and less immune cells. So that means less anti-cancer effect, but also less risk of complications such as graft versus host disease. So that is preferred source in somebody who's young, like Ray, where there are several decades of life ahead, and we don't want rejection complications. Peripheral blood stem cells, on the other hand, are rich in immune cells, so there's quicker recovery of blood cells and more anti-cancer activity. That is usually preferred in patients whose cancer is not in good remission, older patients where bone marrow soil is not good.
So Micah, what was the harvesting experience like for you? Was there, any pain or soreness, recovery?
It wasn't even that long of any soreness. Honestly, it was a couple of days after the procedure where I felt like a little tightness in my back. I couldn't move the way I used to and stuff like that. And I was just fatigued. I was very tired, and that's about it. It was very short length.
Short, in and out. So, LaCheryl, you snapped a photo of the moment when Micah was at Ray's bedside, and you got to watch those cells go into his IV. Was that kind of a special moment?
Yes, I can't even describe the way it felt Both procedures were on the same day. So we were at Children's with Micah, and then the bag was delivered to KU, and then I had to deliver Micah to KU so we could be there with Ray. And so the feeling of sitting there watching is just indescribable. I just don't even know how to describe it.
Well, Micah, we talked about football and marching band, very involved in your high school. I think you did have to miss the homecoming game, but just again, tell us a little bit more about what it's like to be back. I know you've had a huge support with your school. And where do you go, by the way?
I go to Grandview High School.
Great.
Yeah.
Were the kids supportive? I bet they had a lot of questions too, right?
After the procedure, I had messaged some of my friends on the football team, told them I was fine and stuff like that, and I'll be back soon.
You'll be back?
Yeah.
I bet they thought that was pretty cool.
Yeah, and my head coach and my other coaches were very supportive throughout the journey. They were telling me how proud they were of me and stuff like that.
Oh, I bet they were.
Yeah.
I bet they were. A very proud moment for them. So, Ray, let's talk about the gong show here a little bit. There's a photo of you banging the gong there at the BMT unit. Yeah. We know, though.
I think that was, what, twice?
Yeah, I got to do it twice.
Because I kept going I kept going back to the hospital.
So, good. I like it. Bang it. Okay, so, but we know that it's past this. You got the recovery time. We talk about that in crucial 100 days. But how long till you really started feeling better?
I guess the first, it was I started feeling better after the first 100 days. I started getting a little more stronger in eating because I couldn't, I couldn't eat. I couldn't keep them down. It was pretty hard because I wanted to eat, but I couldn't taste anything. So, but, after a while, 3 or 4 weeks, I was able to eat, but it had to be spicy. I couldn't eat anything just regular because I was always constantly chewing it, but not swallowing it. So I think my wife had made me some chicken wings, and I put hot sauce on it, and I was able to eat it.
You had to kick it up a notch.
Yeah, but I was able to swallow it with no problem.
Chicken wings, that's a good recovery food, right? I'm totally on board with this, by the way.
But yeah, I was, like I said, I couldn't keep nothing down.
Yeah.
And I was just constantly chewing it and chewing it and chewing it. It's like, man, I'm getting tired.
Yeah.
So I had to get a napkin, spit it out.
Well, it's
My wife,
those
she
little
said,
things.
"You eat?" I said, "Yeah, I ate."
I bet she was all over it, but it is those little things you take for granted.
Yeah.
Eating, chewing, swallowing, tasting food. I know, LaCheryl, throughout this whole process, you've had so much support. Micah was talking about coaches and friends at school. Who's helped you the most, you and your family the most?
For me personally, I would really say my older son, Brandon. Because Ray is the rock. He's the rock of our family. And so when Ray was sick, I was lost. But we had to tell the boys, and it was Brandon and Micah who reminded me that we trust God. We have faith. So we are not going to be scared. We're going to trust God, and Daddy's going to be okay. So they helped me a lot. I had to do so much more than I was used to doing because Ray used to do everything for us. And so Brandon actually came back home, and he started, he was doing a lot of the shopping and things like that to help. And then Ray's brother Joe kicked in, and he helped us a lot with doctor's appointments, visiting at the hospital, bringing Ray changed sizes probably 4 times. So Joe did a lot of shopping for Ray. So I would say Brandon, Micah, and Joe were the biggest help.
It is not one person. It falls on the shoulders of many and many around you. Hang tight for just a moment. Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. That info is right there on your screen. Before we get to Dr. Hawkinson, I do want to ask Dr. Mushtag about the news that just came out from the FDA. They approved a brand new cancer treatment. It's called TIL. Spelled TIL. It uses your own immune cells to attack tumors. And Dr. Mushtag, you have been researching TIL therapy. So while we have you sitting right here, tell us a little bit more about what it is and what this means for patients.
So this is a remarkable breakthrough for the patients. There are young patients with melanoma, and that has spread or it's not responding to immunotherapy. And for these patients, the life expectancy is measured in few weeks. And this therapy, we resect the tumor, we take the tumor out, and there are immune cells that are in the tumor. And those immune cells, we think, know how the cancer looks like. So we expand and enrich them in the lab and then infuse them back to the patient to fight the cancer. And we have seen 30 to 40% of those patients responding to this therapy. And really encouraging is about 10% of patients with a long-term 5-year follow-up have not had melanoma come back, and that's exciting.
Very exciting.
And this is just the first generation of these therapies, and these will get better in future years with cell engineering.
And we are going to have an entire show talking about TIL therapy, so we're going to have you come back on. Sound good? Thank you so much for that update. Let's get our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning. Good morning.
Hi.
Monday morning.
Good.
How are you?
Yeah, happy Monday.
Yeah.
It's good. Hopefully it'll be warm. Right now, a couple less active patients in the hospital with COVID-19, 21 active patients, but 6 in the ICU, 3 of those on the ventilator. Hopefully this is the start of a downtrend now where we can get down into the teens and then ultimately single digits, and then with any luck at 0 at all in the hospital. So
Hawk, we saw a headline that the CDC may recommend a spring COVID booster, but not for everyone, really only for those who are most vulnerable, like those with weak immune systems or older adults. But it feels kind of weird talking about boosters when still 4 out of 5 adults have not gotten the most recent shot.
Yeah, again, you know, these vaccines are extremely safe. They are efficacious. They do help reduce the risk of hospitalization and severe disease, especially for those that are most at risk. And certainly we know that even since January, possibly even before that, but there has been, and we saw this last year as well, with that bivalent booster, that you could get a second dose or another booster. But the qualifiers there were 8 weeks after your first dose, which most people who have already gotten one are probably more than 8 weeks out. But again, these are for more moderately or severely immunocompromised patients. Of course, the big ones for these are HIV infection, cancer, chemotherapy, either for solid tumors or blood cancers, people who are on immunosuppressants for rheumatologic reasons or because of organ transplant. And there are many other conditions as well that you need to speak with your physicians about, but things like also chronic lung disease, kidney disease, diabetes. Those patients who are at highest risk are eligible to get a second dose of the updated vaccine. And again, that should be occurring at a minimum of 8 weeks from your last one. It will help reduce the risk of hospitalization and severe disease. But I think to your point, Jess, is we just haven't had really optimal uptake of the updated booster for this year across all swaths of our demographic at this point in time in the United States. So we still need to get those people who haven't get that updated booster to help reduce your risk of hospitalization and severe disease. But also remember, talk to your medical providers. If you are a person who is moderately to severely immunocompromised, you can get that second dose at least 8 weeks after this first one.
All right, Hawk, thanks so much.
Yeah.
Let's get to a couple quick questions from our viewers. Yen Liang wants to know, which one is better, CAR T therapy or blood cell transplant in a case like this one or maybe others similar to it?
So it is very different therapies, and it's like it's a lengthy answer. But if somebody's cancer is not going into remission, then CAR T cells are used, and these cells fight the cancer and induce remission. Once somebody is in remission, to maintain the remission, a bone marrow transplant is used that replaces their immune system with a new one and reduces the chances of cancer coming back.
So on that note, do donors need to be the same race as a recipient, and is there any such thing as just the ideal donor?
No, a donor doesn't have to be the same race. They have to match genetically. Yes, there are several factors that we consider, but an ideal donor is a young man and ideally a fully matched sibling. And if you don't have that, then a fully matched unrelated donor. And now with advances in the medicines used to prevent rejections, graft versus host disease, we can use partial matches such as Micah with exactly the same outcomes that we have with fully matched donors.
So I want to get our takeaways today. Dr. Bushtag, let's stick with you. What do you want people to know?
So two things. So one is that the bone marrow transplant cures blood cancer and blood disorders. These are very curable diseases. We are lucky to have University of Kansas blood and marrow transplant program. We do over 300 transplants a year. The program is ranked among top 15 with a 1-year survival of almost 80%. And that's only possible with the support, these extended social support networks and our team that we have. But one missing piece of the puzzle is the donor. So if you are an African American, your chances of finding a donor are in the registry, unrelated donor, at 29%. Compared to 79% if you're a Caucasian. So my message is that go to National Marrow Donor Program Be the Match website.
It's very easy, right? You just swab and send it back in?
Sign up as a donor and they'll send you a kit at your address. You swab and send it back and you will be on the registry.
And then you wait for a phone call.
Yes.
Yeah,
yes.
never know when it might come and you can save a life.
Yeah.
Ray, what's the takeaway from your story?
Takeaway from my story is, I have to, if it wasn't for, my faith and my family, oh man, it was, that was the main thing that, helped me to pull me through.
Yeah.
Because, when I first found out that I had it, it was all kind of negative things going through my head, and I was trying to make sure everything is in place, far as, if I had the wheel and all this. It was just all over the place. But, like I say, through my faith and my family, it ended up being good.
Sure did.
Yeah.
Another takeaway, always listen to your wife.
Oh, yeah.
Yes, ma'am. Okay, Micah, just what's the takeaway from this story?
My takeaway is that things like this, they take time and patience, and if it's worth saving a life, you can do it.
You did good.
Yes.
You did good, my friend.
Thank
All
you.
right, Mama. So, LaCheryl, I'm going to let you wrap us up today. What's the big takeaway from your family story?
For me, it's information. Learn about donation and the process. I didn't want my baby to do it because I didn't understand. But once I learned about the process, I knew that I knew we were going to do it. But knowing the process, knowing more about it made the decision easier. So information, learn about it, and donate.
Donate. Dr. Bushtag, thank you for being here, and thank you, Rainey's, for sharing your story with us. Really important.
Thank you for having us.
Thank you. All right, thank you to all of our viewers for being with us today. We'll see you back here tomorrow at 8. Mila Ellsworth had 2 different types of cancer in one breast, and understanding the nuance meant everything for her treatment. I'm Alexis Del Cid on the next Morning Medical Update, how genetic testing guided her treatment and why her options for breast reconstruction were limited because she was in such great shape. That's coming up Tuesday at 8 a.m.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.